Hello and welcome. I'm Dr. Israel Barkin, the Medical Director of the Prostate Cancer Research and Education Foundation. Every Tuesday, 6 p.m. Pacific Time, we have a live call-in show, Ask Dr. Barkin call-in show, which you could join us every Tuesday. To find information about the shows, you could get on our website, www.pcref.org. Let's go now to one of the abstracts that will be discussed September 28, 2010. The name of the article is Green Light Laser versus Diode Laser Vaporization of the Prostate. Comparative clinical experience. This was done at Chang-Gung University in Taiwan. And it's important to know that they compared here two types of lasers, fairly new developed laser machine that use vaporization, and they checked the symptom score, the maximum flow rate, the post-void residual, and the quality of life between these two machines. Let's look at the results. There was a statistically significant difference in the symptom score, the maximum flow, the post-void residual, and quality of life in each laser group at 1, 6, and 12 months follow-up compared with baseline. But there was no statistical significant difference in any of these parameters at any follow-up time between the two groups. So the result of the efficacy of these two new machines was about the same, but there were some important differences between the diode and the green light laser. The diode laser demonstrated superior hemostatic properties. That means it was easier to control bleeding during the procedure compared to the green light laser. That meant that during the green light laser procedure, 10% of the patient needed some intervention by different instruments to try to stop the bleeding. Post-operative incontinence and post-operative irritative voiding symptoms were more pronounced after the diode laser prostatectomy. Higher incidence of burning on urination and sloughing of tissue with epididymitis was noted after diode laser prostatectomy. It should be understood that the diode laser was found to be more powerful, to have a better ability to evaporate the tissue, to coagulate them, and to go deeper and decrease the volume of the prostate more than after laser prostatectomy. And therefore there were some differences here in the bleeding and in the symptoms. The conclusions that both lasers can improve subjective and objective parameters of the voiding symptoms and measurements of the voiding, but they also can produce undesired side effects, and my recommendation to any patient considering any of these supposedly minimal intervention by alternative to the transurethral resection of the prostate to look at the side effects too. For the time being, there is no ideal treatment for vaporization of the prostate. This issue of vaporization is extremely important for patients who have prostate cancer. When you have prostate cancer and we use the transurethral resection, which is the electrical wire instrument that cuts through tissue, that creates bleeding, and there is some concerns about the bleeding during the procedure because cancer tends to bleed more. But besides that, there is a theoretical question whether by cutting through blood vessels with cancer around, whether you infuse those cancer cells in the circulation. By using other techniques, less invasive, that use vaporization and coagulation of the tissue, there is much less bleeding, and there is no absorption of fluid during this procedure, and theoretically less possibility that you spread any cancer cells in the body. Therefore, any patient who also has obstructive voiding symptoms and prostate cancer should pay a bit attention and discuss it with his doctor, and I think this is one of the indications to try to look at alternative to transurethral resection of the prostate. Thank you very much for listening to this presentation. I hope you could join me live on one of our shows over the phone, which is every Tuesday, 6 p.m. Pacific time. If you missed one of the shows, you could always download it from our website of the Prostate Cancer Research and Education websites, which is www.pcref.org. And you could ask a question at any time, even about shows that were aired previously. Thank you very much for listening again. Stay well, stay informed. Goodbye.